the male eval and treatment.
Oh yeah.
Do you think we could kind of like go through, like if you were going to see a male, like how you would,
Mm-hmm.
or
That
like
would, yeah.
things you would connect, or like common symptoms you see and what things help, or like whatever.
I think like the most helpful thing might be actually like, does this little pop-up keep showing up, the force quit applications?
Mm-mm.
Okay. I keep getting a pop-up. It might actually be helpful to like jump to the bottom of the paper. So I like have just like two schemas written out and it's like crazy. Like I know it's not great to like talk about people and like just put people in a box and say they're like this, but it just seems like it's helpful for learning. Um, so typically like this is in general. We'll see like two types of males. One is these younger males and like say like your husband, like it would be so rare that he would be like having pelvic floor weakness. Like young men just don't have pelvic floor weakness unless they have like a neuromuscular disorder, pretty much. Um, even if they're like really out of shape, like they still shouldn't be having dysfunction from weakness. Like that would be really strange. Unless maybe like they did happen to have like cancer and they had like when you get your prostate removed, it's almost kind of like after a hysterectomy, like you lose some of the internal
Mm-hmm.
support.
Mm-hmm.
So
That makes
that's why
sense.
like males will have like start to have leakage after that. But so one schema is like these young men, they have really high stress jobs, like, and it's just like it almost cracks me up. It's like they're usually in the financial field or an engineer or like in like tech type thing. And just like from all the sitting and the stress, like they're having all these symptoms of tightness in their pelvic floor. So high stress professionals, see jobs. A lot of times they'll have pelvic pain, which can be like back, hips, penile, like I don't know, testicular pain or just perineal pain, really anywhere. Sometimes people will have like sexual dysfunction. Um, and then like with this, a lot of times they'll have urinary symptoms, like a weak or slow stream or like hesitancy. A lot of males will like have that, like they get to the urinal and they like it just like won't come out. Um, and then yeah, but all these kind of go together. It's almost like when women have tightness too, like
Mm-hmm.
they might have that slow stream, pain with sex, just pelvic pain, constipation. So typically we're doing a full plan of care. I mean, maybe some of them would be just the 60-day, but I usually am really, oh, and we should talk about this too. I really am heavy in like the mobilize phase for them and mobilizing and like coordination. I think that's like the biggest thing I see with these types of people and education. Um, Key interventions, the deep breathing, down training and mindfulness, and just like mental health, manual therapy. I usually do mostly external. And there's a lot of males that are like, what? Like, no, I don't want a rectal exam. Like, males are a lot more like, cool with that being like last resort.
Yeah.
Even though occasionally we'll get a mail and they'll call and like ask like do you guys do rectal work, like I was told like I need to call a pelvic floor therapy place that like they do rectal work, like my urologist said that or something, or they do like a lot of googling. um Ergonomics, that can be good, just like talking to them like about their work setup and seeing if they can like set an alarm to get up and walk around their office every hour or something. um when uh Marissa took that course, she found like a lot of dysfunction can be stemming from the lumbar spine too, for males. So, have you heard of this like McKenzie repeated flexion and extension? Um, you're supposed to like treat in the direction of symptom relief, and she said for these younger males, typically it's like into extension. So you could do like prone extension exercises if they have like a lumbar component or like complaint of back pain.
And you just do like up and hold for a longer period or like up, down.
Yeah, I usually do it like prone, like they're laying prone on the mat. Usually I start with just like up onto elbows, like almost like a
Mm-hmm.
plank, and then you just like go back down. Like you do just like go up and then you go back down, up, hold for a minute maybe, and then down. And then they can progress to like straight arms, like I don't know what that's called, cobra.
Mm-hmm.
And then they go down. So I think typically it's like 10 to 20 reps. And I think for true Mackenzie, you're supposed to do that a couple times per day. But
Mm-hmm.
I mean, in practice, like even a couple times a week, like does help. So, um, but yeah, like if their symptoms are worsening with that, like they might be better into like flexion, I
Flexion.
guess. You can do it like seated, like roll down the spine, but um I don't know. I guess I've never really had a young male that I treated into like flexion before. That's
Okay.
probably like older people. Um, and I think it's hard, like if they're if we're not doing internal work, if they're not open to internal work, like 12 visits is a lot to do like mobilize and lengthening and stuff. So sometimes we'll just do like a different way of loosening the muscles, like foam rolling. There's some like good videos on like how to foam roll the whole body. Like, have you seen those where you like lay on the foam roller and you kind of like do it on your
Mm-mm.
hand? I can kind of show you.
I mean, I know how to foam roll the IT band and the adductors and the piriformis and like
Yeah.
yeah.
There's like one, like you can have your patient like do their own foam rolling too, where they're like moving their body on the foam roller.
Okay.
I think I have a video on that. Um, I mean, internal rectal would probably be like the most direct approach. Um, I'm just trying to think how we can train on that. Like, I probably would just start by going through the Nicole Cozine videos.
Yeah, I will.
Yeah. I mean that's kind of how what we've been doing. Like, we usually don't have time to train on it like during the initial trainings. Plus, I think it's like too much information,
Yeah.
especially like I mean, you have like some background, but some people this is like
All
what?
new. Mm-hmm.
Like
Yep.
Vanessa, actually, she hadn't even gone to Herman Wallace before we had to have her start trading. So, yeah. Okay. So, or you could teach them the wand, but it seems like the males in general, like they're more like, no, just do it. Like I'm gonna just lay flat. Like education's a big one. I mean, I think the stress is like what's driving most of this and like too
Yeah.
much sitting, like just going out for a walk every day can really help and like stretching and like building their like self-efficacy and like because I think people do spiral like if they have like a weird encounter because they're like a weird sexual encounter because of their tension and then it just like spirals like they're so
Mm-hmm.
nervous like oh my gosh am I gonna like have this pain or like premature ejaculation and um so then and this is the same with like pain with sex people. I don't usually just do like manual and stretches. I think it really helps to like go into activate, which is more like the coordination piece, just to like help build like mind body awareness. Um, like, oh, I am actually holding like tension. Like, can I release? Can I relax? Can I tense when I want to? Um, I mean, for a male, you probably wouldn't even need to go into dominate. Like, what's it gonna do to go in the gym to like lift heavy weights? Like, when their issue is like premature ejaculation, like maybe but it's more about like releasing and like coordinating. Um, so like even the TRA, a lot of guys like cannot figure that out or even just how to Kegel. So you could have them like Kegel and sideline and look at that. Um, like can they do that or are they just squeezing their butt cheeks together? Um, can they engage TRA with like butterflies, bridges, pelvic tilts? Those are for whatever reason, I know this is like kind of sexist to say or whatever, but like I don't know why the males just like have such trouble with like pelvic tilts.
Mm-hmm.
Um, Bianca likes to do it with patients like standing on a wall and then like pressing their back into it and then arching their back. She finds that works well with males. Um, so there's like a typical, this is like a really common imbalance for these seated
Mm-hmm.
professions. So this is supposed to be a graph, but these are the muscles that are tight, like low back, QL. They have like that arch in their back. They have more of like that anterior pelvic tilt. And because of that, they have like tight quads because their pelvis is tilted forward, shortening the muscles. They're seated. Anyway, all these muscles become tight. And then like the posterior chain gets really weak, like glute max, glute med. So that's like a big one to like hit for strengthening actually. And like the TR, like the deep core gets weak. Um, so that can be like a good framework too, is like during treatment, focusing on relaxing these muscles and engaging these ones for people with like seated jobs, even women too.
Mm-hmm.
So this is like the typical movement patterns. They have anterior pelvic tilt, that low back arch. They have like decreased hip extension and gait, pelvic floor overactivity.
I like that.
Then, then this is the second schema of males that we'll see. These are typically males that are coming in after a prostatectomy. So their prostate was removed, usually because of like cancer. And the prostate like sits right above the bladder and yeah, it helps. Wait, is it above the bladder?
It's like below the right, like right on the around the urethra.
Yeah.
Like right. I'm pretty sure.
Yeah. So it does give like support. So then it's like,
Mm-hmm.
oh, well, guess what? Like us women, we don't even have a prostate. So we have to just like cope like this all the time. And now like you don't have a prostate, like, yeah, this is what we deal with. Um,
Mm-hmm.
so post prostatectomy, or they could just be like aging and getting weak, or maybe they develop Parkinson's or something. Then they're having more like the stress incontinence versus like the younger males maybe more urge incontinence, which is more common with like tension. And then typically there's some sexual dysfunction, like difficulty achieving an erection or whatever. I will say some of the dysfunction in males, back to like the mental component. I mean, there's definitely like a problem with like overuse of phones, and like connection with partners, and like porn really, really can make it hard for males with this sexual dysfunction. But that's kind of hard to talk through. I think like some of that stuff, like a good referral is like a sex therapist. Have you heard of sex therapists?
Oh yeah. Yep. How do you like come to that conclusion or like
Mm-hmm.
because I
Um,
and like start that conversation as well? Or does
let's
it just kind of like happen throughout?
I think it usually just like Lexi has one and she's like, I think he's just like so addicted to porn because he'll like talk about it all the time. Like, I don't know. I don't know how like that, but like when he's talking about his dysfunction, he's also talking about like what he and stuff.
Okay.
Um, um, let's see, what was the other thing? Porn. Well, oh, I heard you guys talking about Lindsay and Doug Vestal. Their big thing is like decreasing phone usage and like improving like personal connection. So I think that can help.
Mm-hmm.
I think like the performance anxiety is a thing with these guys, like both the younger and the older. So I think just like, I mean, sometimes we'll like even ask, like, is this dysfunction present? I mean, this is really awkward to ask, but like, is this present when you're with your partner, or is it more if you're like masturbating, or both? Because I think like if it's like really pelvic pain, like only with partner, like then you kind of think like there might be like an anxiety piece and like performance like playing into it. Um, I don't know.
Mm-hmm.
Like I said, like I'm a fly on the wall. I'm just like, what did I say? Like I'm not.
Uh-huh. Did it come out okay?
Oh. But I think it's just been like, oh, the males are so, so grateful and like we're the greatest good there's ever gonna get. So,
Mm-hmm. Okay.
all right. The older males, I've never done a pelvic exam on like these older males. Like I'll just have them lay in side lying and be like, oh, can you do a Kegel? Yeah, I'm Kegel. And they're squeezing their butt cheeks, and you're like, no, like, no, don't squeeze your butt cheeks. Like, pretend like you're like, I don't know, like holding back gas. Oh, yep, I'm doing it. Like, no. So a lot of, for them is just like strengthening and coordination. And like when in doubt, like even just strengthening their hips and glutes can help a lot. Um, and like the self-efficacy, because some of these are on like hormone suppression for their cancer. So they're like pretty weak and like but they still can do stuff. Like, so I think even doing like I'm gonna send you with 10-pound dumbbells. Like, I just have found like the males, like just having the dumbbells in their hands, like just makes them feel so good. Like doing a squat with dumbbells, even though it's like that's like 10 pounds. But like if they just feel so great. So that helps a lot. Um, Simple pose, I don't know. This is like where it's like a judgment call. Like if it's simple, I mean, we can get them better in 8 visits a lot of times for because it's like usually just weakness. But if they're having a lot of sexual dysfunction or like there's some like they have confusion, like I don't know. I think we have almost found like it's almost better to err on like booking too many than like people being disappointed if they're not like better when we thought they were going to get better. Like I don't know. I've never had a patient like, oh, like I'm so mad, like I'm already better and like I still have 2 visits left. Like this is sucky. Like usually we'll just book those like a month out for like a wellness check or something.
Mm-hmm.
So I guess like if you're not super sure, I think that's probably better, but if you're pretty like I mean it is a judgment call like and we don't know like something might come out that they don't say during eval. We are just like doing our best. So I guess like if you recommend 60 days, like you can be pretty honest with people. Like, okay, like I real like I this is turning out more complicated than I thought. Like I think we're gonna need to do another month of our program. Like most people do the 3 months. Like I was really thinking like we could nip it in two. And and I'll sometimes even say like are you open to doing that? And a lot of people are. Like, I think if they like know us and they like feel we're giving like a really honest answer. Um, so now to the eval.
So
Um,
if you, so let me ask you, because you're talking about, so outside of like the 90-day program, which would be about the 12 visits, right? If you're thinking that that person doesn't need that much,
mhm,
when you go to book out, it wouldn't be a package then? It would, or do you have, you do have 60-day and 30-day. Okay.
yeah,
I do recall that. Okay.
yeah. So I think there will be some patients that we're gonna be doing just the 60-day with. Like if it's a really straightforward male or like someone that's like it's just kind of like a little bit of core weakness and C-section or like scar, like I think like the only reason it would be the 30-day is like if they are absolutely unwilling to book more than a month or because it's like hard to do much in like just a few visits.
Yeah.
Or maybe let's see. Or if someone's like, maybe they're like a healthcare provider and they're like, I okay, like I'm a massage therapist. Like I really like, can you just teach me how to do like scar work like on my C-section? Like I
Mm.
don't know how to do that. Like, but I'll do it on myself. Like I can. I just need to learn how. Like, so there might be those. So for the males, I guess it's like a lot of the same questions, but I usually keep those two schemas in mind because if I'm like, okay, it's a younger male, I'm gonna be more like, okay, do you have any urinary like when you go to the bathroom, does your urine come out right away or is it difficult to get it all out? Um, are you noticing any sexual health issues, like premature ejaculation? I usually like really just outright ask that because they sometimes don't offer that. And almost all the guys, it's like that's one of their biggest concerns if they have, if they're coming in, but sometimes not. Um, People don't like to pee their pants either. So, yeah, so these are kind of like the some of the potty questions and sexual health. Do you want me to read all these?
No, 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 no. I
And
just didn't know if you had any. I like basically, I think what I was asking is what you took me to at the end. Like,
okay.
how, where does your head go when someone tells you that they're having this symptom? Or, you know what I mean?
Yep. I would say like if I'm gonna do a male eval, usually like my objective is gonna be like I'll do like the spine range of motion, like okay, touch your toes, now lean back, side. Um, and then I'll do like the core check, like all right, lift both of your legs up, all right, yep. And then probably gonna dome, even the old people. Then I'll have them like roll to their side. Do you know how to like look at someone doing a Kegel and side lying?
Yeah, I think so. Like palpating or like visually assessing. Yeah.
Usually I'll do that if they're willing. And um
Do you just palpate like, um, hold on, sorry.
it's kind of like just medial to their sit bones.
Yeah, okay.
Yeah. I actually usually just watch there. Like you should be able to like see movement. And whatever I see, I mean, I just use it in accordance with like my what they gave me on the subjective. So like if I see little movement and it's like a young male, like he does like a squat, like great, like he looks strong, like I'm not gonna be like, oh, your pelvic floor is really weak, like it only moved this much. Like I'm gonna be more like, okay, like based on his subjective, like he's probably just like stuck. That's why it's not moving. Where like the old person, like that had a prostate removed, like you see like a little flicker, you're probably like, well, they're probably just really weak. And then I like,
Mm-hmm.
take that and run with it with like how I present, I don't know, my treatment plan, I guess.
Mm-hmm. Okay. That's helpful.
Sometimes, like, if we do have a male that like really wants an internal exam, like, I honestly like, even for the safety of us, like, I like to wait till like a further out session, at least till the second. And so sometimes we'll like, even though this is kind of white lie, like, I'll say, like, oh, we don't really do an internal exam on our first day because we have so much subjective to talk about. Like, we have a bunch of other tests we do. So usually we do that like in an upcoming session. That's gone over okay.
Mel said something along the lines of like, usually we'll start with more conservative approach. If we're not seeing any improvement, then we could look at. I kind of liked that.
Yeah. Yeah. And that was good. That kind of like bought her some time to
Mm-hmm.
practice and like wrap her head around it all.
Mm-hmm.
But yeah, I think as long as you can get through a good subjective, which you will, um and then like a couple objective things, you'll be able to make it through. And then we can talk through like what his treatment would look like in real life.
Yeah. Okay.
What is his issue? Does it say?
No, he's the one that doesn't have any notes.
Of course. The one we want the notes for. Oh, okay. I guess we should talk about this because this is a little confusing too. I think this is the last thing I wanted to make sure I said. So when you're like doing the eval wrap up and you're talking through like the three phases, to me, and I just might be like a little different in how I treat. I don't think our treatment method like really makes sense for like a pain with sex case. Like, so I usually like I'll say like 90 days, mostly because like it does take time for pain with sex to resolve because there's like a mental component, a physical component, like there's so much going on with those. Um, but usually I just like explain the lengthening and the activate phase. Um, I mean, some people like they have like high level goals, but like if people like their goals just to have like sex with their partner, like they probably don't. I mean, they might, but like it's not going to be a huge focus, I don't think, like doing high level exercises or whatever. So
Yeah.
usually, like you'll see in one of my wrap ups, I actually say like I think you'd be a great candidate for our 90-day program. For pain with sex, we break this into two phases. The first phase is the first half of your program. We're going to be working through like release work on these muscles. And you had so much tension in layer one. We're going to work through that first, blah, blah, blah. And then phase two, we're going to do more of like coordinating. So you don't have to keep seeing us to like keep these muscles relaxed. Like you have the coordination to like keep them relaxed on your own and like the education and tools you need to like maintain this long term. How does that sound? Like that's pretty much it. And I don't really go into like the dominate phase, but you could. I mean, I think Lexi does. I don't know how she really swings that, but I for like pain with sex people and like constipation, usually I just say like, and mostly because like I spend the majority of their treatment like in the mobilize phase for like pain with sex,
Mm-hmm.
and like pelvic pain issues. So
Mm-hmm.
yeah.
Okay.
I think that's the only, those are kind of the only two that don't really follow that same. Um, I think you could go that route with male pelvic pain too, but because I think the tendency, if you say it the other way, like you say, then we're gonna get working really hard and really testing your body, like the response sometimes is like, oh, I don't need to like take my body to the extreme. Like I just want to like have sex with my partner. Like I don't need to.
Mm-hmm.
So it's like confusing, I think, for people or like even for males, they'll be like, "No, like I go to the gym already." Like um so I have found it a little easier to just say like the first two phases and like and that really is like how I usually treat like pain with sex or like pelvic pain is more like the release work. And then the second phase is like, I do get into like TRA activation and all the coordination so they like can volitionally like contract, relax, and stuff.
Yeah. Okay. That makes sense.
Mm-hmm. Cool. You want to go through anything else?
I don't think so. Let me look at her.
I'm gonna put some meetings on your schedule too. Usually I try to do either me or Lexi will try to do like weekly meetings to like go through your cases together and stuff.
Mm-hmm.
I usually try to schedule with Lexi because I'll be in contact a lot with you and I want to keep you connected with her too. Oops.
Um, I know we. This is like a side note, I guess.
Hmm?
I know we talked about me like doing some other things for you, so you just like let me know what you think that looks like. Like,
Yeah, yeah. Thanks for bringing that up. I think I think we'll just see how it goes. I I really would love to like I think like my vision is I think I see Battle Creek like Saginaw. Like it's a really similar population size, like socioeconomic, and like actually Saginaw's like our biggest clinic. Like it's still a little bigger than Troy even. I think I think you'll be pretty busy with patient care, I think eventually I I would love to have you like doing kind of similar stuff to like what Lexi's doing if you're comfortable with it. Um,
Mm-hmm.
like kind of helping get other staff going. That's why I really wanted to make sure I met with you and like went through the eval script and everything because eventually I might have you helping other girls and I don't know.
Mm-hmm.
Um, so I'll let you know if there's other tasks, but I think like I really want to get your schedule full. And because like I have this office manager coming on, I think like I was almost gonna have you do like almost like office manager type stuff. But then I just kind of decided like I just need to get an office manager. Like I'd rather have you like in your zone, like treating patients and if you're not full, like then doing like community outreach and like workshops and stuff. Like even if it's like a once a week workshop, which would be a lot, but um I mean, we can fill your schedule like if we have to, like we can fill it on workshops.
Well,
Ideally,
and I feel like it'll kind of come at a good time. So, like, starting in December, like, see where the natural flow of it goes. And then come January, people are like,
hmm
you're through the house, whatever.
yeah,
So, okay.
yeah. So I guess like we talked about with your setup. So we're doing 20 hours, 2 tens, right? And then
Mm-hmm.
you're like salaried at 20 hours and then in 60 I don't even know if I have that on your schedule right now. In 60 days we'll go to like 3 tens. Is that what we're
Mm-hmm.
doing?
Yeah, that's fine.
Okay. I feel like that's gonna be a lot, but
Well,
um,
we can just like play it. Let's just see. Because who knows, like, what conversations will happen with Abby. Like, yeah.
hmm yeah, yeah, because we could, I mean, you could even do like 4 shorter days if that's better.
Mm-hmm.
But yeah, whatever you think too with like your kids and stuff. But
Okay.
um, yeah, I think this will be good. I'm really excited. I hope you like it.
I have, like I said, I have good feelings.
Good. Cool. So next week we are meeting at Grassroots.